Let's say. So if you look at this, this is her heart, right? The first thing that you can see, this is like an enlarged aortic arc. It's a sign that she's hypertensive. So many people don't have, who are not hypertensive, it's more flatter than this. But the minute it's more prominent like that, then you know. But that's what I was to get to. So a cardiothoracic ratio, you measure the inside of the thoracic cage, né? From here to here, right? And then let's say you get 10 centimeters. Then half of 10 is what? Is 5 centimeters. So you don't want that heart to be more than 50%. Ne? So when you measure from here to here, you must take the largest portion of the heart, right? This is how you do it. So this is the largest, right? Then you put this, and then you put this here. So the inside, ne? Like that, ne? So half should be somewhere here, right? And if I put this here, look at that. This is the enlargement. This part is the enlargement. Can you see?
Yeah.
It's a quick way of doing cardiothoracic ratio. So this is cardiomegaly. The thing is this, with her, she's not symptomatic. If you look at the New York Heart Failure classification, there's 1, there's 2, there's 3, there's 4. 1 is someone who's got heart failure, but they are asymptomatic. She's asymptomatic, but the heart is, there is no reason why she should be having an enlarged heart like that. She's got subclinical heart failure. The minute, I mean, when she comes in, then she's symptomatic, it's already too late. She's a class 3 and a class 4. You want to pick them up when they are still asymptomatic for you to be able to do something. If you can do it, you say, hey, BNP is normal. It wasn't done. If you can do yourself a favor, do that BNP, send her to do, and then take a sticker, we're going to check it tomorrow. Her BNP is going to be above 300. If you've got a patient who's asymptomatic and then you do a pro BNP, BNP is very specific for heart failure. Even if the X-ray is normal, as long as the BNP is more than 300, then you know that patient's got heart failure. But they don't have cardiomegaly. You can have heart failure without cardiomegaly, right? You can have heart failure and still be asymptomatic. So guys, so the students, what I'm trying to explain in this short clip is the concept of cardiothoracic ratio. And the students, they brought to me, they saw this lady. Cannot really remember because I didn't track her myself, but she's a female. She's above 55 years. So she's hypertensive, and she's only hypertensive. She was on atenolol. So it turns out that she was seen yesterday, and her BP was, I think it was 165/114, something like that. So obviously she was assessed as a hypertensive crisis, and the doctor that saw the patient, so they tried to lower the blood pressure, and then they took blood. The blood that they took UNE, they took I think CRP, they took also HbA1c. So now the students, they reclacked the patient, then they came to me to present the patient. So I saw that one of the things that were done yesterday was a chest x-ray. Her BP today was I can't remember, but it was a bit lower than this, though. She was not in a crisis anymore according to those readings, but I can't remember. So but what I want to get to, so I said to them, okay, first of all, let's go and check the x-ray of this patient. These students, they hijacked me, guys, because I'm in psychiatry, but they hijacked me. They are doing family medicine, but yeah. So when we saw her x-ray, which you can see, which you saw on the clip, so I was trying to explain to them the concept of a cardiothoracic ratio, a quick way of deciding if your patient has got a cardiomegaly or not. So what you do, so what I was trying to what I was explaining to them is that when you get that prominent aortic arc there, it's common. This thing is commonly seen in hypertension. So it's very common in hypertension. Many people who are hypertensive, they've got a prominent aortic arc. Yeah. So what I was trying to explain to them is that to decide, in this patient, the cardiomegaly was just obvious, without even trying to figure it out. It was just obvious. And then, so what I was trying to explain to them is this thing of a cardiothoracic ratio. So what you do is, remember, these are your ribs, right? These are your ribs. 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 Ribs. So what you do, just take a piece of paper, and then you put it from the inner wall of the rib cage to the other side, to the inner wall, also on this side. And you must take the largest diameter of the heart, the largest diameter. So you can't do it up here. So take the largest. So, and then you can just put your ruler or put a piece of paper if you can. So you put a ruler from, let's say this is the largest, so you put your ruler like that up to here, and then what I normally do, because we don't always walk around carrying rulers, so what I normally do is I put this, let's say this is fitting into, it gets to this, to this part. Now I go in the middle and I make my mark. So what I expect is that whatever that you get, the distance from here to here, so you measure the distance from here to here, and then the distance that is over, the distance from here to here should not be more than 50%. So the distance from here, let's say if you measure from here to here, and then you get, like I explained in the video, you get 10 centimeters, for instance, then the distance from here to here, which is the distance over the way where the heart is, so the distance from here to here should not be more than 5 centimeters. So if you do this, and then you get this, and then you put this here, then the minute in here, you see that her 50% runs up until towards here. If you look at her x-ray nicely, you will see that her heart is like this. It goes like this, and then there's a minimal space that is left here. So she has a cardiomegaly. So I'm saying the easiest way of doing it, you measure from here to here, and then get to and then divide that into half. Then the heart should not be more than whatever that you get, whatever distance that you get, your heart should be that or less, not more than that. So that's an enlarged that's a cardiomegaly. That's an enlarged heart. So now what I was saying to them is that according to the presentation, I didn't hear them talk about any features or signs of heart failure, but I suspect that she has. But it doesn't really kind of matter at this point. The fact that she's got, remember, as I explained on my videos, with heart failure, according to the New York heart classification, you've got grade 1, grade 2, grade 3, and then you've got grade 4. These are your symptomatic patients. So class 1 is someone who has heart failure, but they are still asymptomatic, right? Now, what I was trying to say to them is that the absence of cardiomegaly does not rule out heart failure. Number one. Number two, the absence of heart failure symptoms does not really rule out heart failure, because we have class 1. These are asymptomatic patients, and these patients, you can only pick them up once you do a BNP or pro BNP. So I think it's just, there isn't really a guideline that tells you when should you do a BNP on a patient. I think if I were to be a consultant somewhere, I would actually put BNP as a protocol. It's a part of the protocol, something that needs to be done, but I just have to figure it out, when should it be done, and all of that. Should it be done as a screening? Because the truth of the matter is that BNP is gonna go up even before you see the cardiomegaly. By the time you see the cardiomegaly, is already late. By the time the patient is symptomatic, is already late. So that's the point. So a BNP that is more than 300 does confirm heart enlargement. So I think it's something to think about in terms of the guidelines and the protocol and all those things. So yeah, guys, if you have not watched my video on heart failure where I discuss heart failure, please do, and also where I discuss hypertensive crisis, because as we say, when do you say this is hypertensive crisis, it all depends on the blood pressure, the reading of the blood pressure. And also, once you get to hypertensive crisis, you need to decide, is it hypertensive urgency or is it hypertensive emergency? It depends on the target organ damage. Ne? So as we manage these patients with the students now, so we had to put this patient on anti-failure. So she had to be in enalapril, she had to be on a Lasix, she had to be on atenolol as well. She was only on atenolol alone. So that's why her blood pressure was not controlled and all those things. And another thing that we had to do is to take bloods for BNP and also to take bloods for lipogram to check if she might be having dyslipidemia. Remember, dyslipidemias, they do cause uncontrolled hypertension. So yeah, guys, that's that.